Welcome to the Discovery Pod, where we talk to leading experts from the University of Adelaide about solutions to society's most pressing challenges. The gift of life. How do we build healthy habits today to give our children the best start in life? Today, I'm joined by Jodie Dodd, obstetrician and internationally recognised expert on mothers and children's health, and Alison Kerr, Heart Foundation Fellow investigating pregnancy disorders and health outcomes in children. Good morning.
Morning.
For the first time in modern history, children in developed countries may not live as long as their parents due to diet-associated health problems like heart disease, strokes and cancers. It's a shocking prediction and one which could be avoided. We continue to discover more about pregnancy and parental health, where we're going wrong and what we can do about it. So Jodie, maybe we can start with you. What is the relationship between mother's health and children's health?
I think we're finding out increasingly that what happens to women prior to pregnancy, but also during pregnancy, has a very, very big impact on the health of their children. And that can be through complications related to pregnancy, so things like hypertension or gestational diabetes, but also more broadly through overweight and obesity and the impact that that can have on children. There are very, very clear links between maternal overweight and obesity and their children being at risk of also becoming obese, and that can occur from very, very early on in life. So we're talking sort of prior to preschool, that some children are exhibiting behaviours that place them at increased risk of child obesity. So targeting pregnancy in many ways is a way of trying to improve the health for the women in the first instance, but also improving the longer term health for their children.
So it's a kind of proactive health measure that
yes.
We can all investigate and start to
Absolutely.
undertake. Yeah.
Yes.
So Jodie, to investigate some of these issues, you've actually got a large amount of funding from federal sources to conduct large-scale trials.
Yes, that's correct. So the LIMIT study, which was our pregnancy intervention study involving overweight and obese pregnant women, was funded through the National Health and Medical Research Council. Our pre-pregnancy study, which is targeting women prior to conception, has just recently been funded by the Medical Research Futures Fund, so the MRFF.
Yeah. So tell us a bit more about the LIMIT study.
What we've attempted to do with the LIMIT study was to try and provide a dietary and lifestyle intervention to help women limit the amount of weight that they gain during pregnancy, because there is a lot of literature that suggests that limiting weight gain in pregnancy for women can reduce their chance of things like gestational diabetes and hypertension. So the LIMIT study was conducted in South Australia and recruited 2,200 women to that study. Half of the women were provided with a dietary and lifestyle intervention to help them develop some healthy eating habits and regular physical activity during pregnancy. And the other half received standard antenatal care, which currently doesn't really involve any specific dietary recommendations. What we found was that there was no difference between the two groups with regards to the amount of weight that women gained during pregnancy. Most women who participated in the study still gained on average around 9 kilos during the course of their pregnancy. Yeah. We did find a suggestion of a reduction in high infant birth weight, and that's been one of the factors that's been linked very, very closely to an increased risk of childhood obesity. So initially that was a very promising finding, but what we found when we continued to follow the children at 6 months, 18 months, 3 to 5 years, and now we've started 8 to 10 year follow-up, is that there really hasn't been any persistent difference between the two groups with regards to the child's risk of obesity. Around 40% of children in both groups are at risk of overweight or obesity, but not different because of the pregnancy intervention. And that's actually led us to look in a little bit more detail at the relationship between weight gain in pregnancy and the risk of adverse outcomes for women. And we've actually been able to demonstrate, using our data from our large studies, that it doesn't actually, there's no direct relationship between weight gain and pregnancy outcomes, which is, I guess, in some ways breaking that myth, because I think a lot of women are given very very strong information about limiting their weight gain during pregnancy, but we've been able to show that that probably is not the area that we need to be focusing on.
So what is the area we should be focusing on?
I think the area that we're now tackling is looking at preparing women for pregnancy and actually encouraging women and families to make healthy choices before conceiving. So we've been successful in receiving some grant money from the MRFF and we'll be embarking on a large-scale clinical trial to target women prior to conception. So we're looking at women who are overweight or obese who are planning to fall pregnant in the next sort of 2 years or so, and providing an intervention to help them lose weight. And we're not talking about significant degrees of weight loss. There's literature that shows that even a modest 3 to 5 kilo weight loss before conception can have a significant and profound effect in terms of reducing risk of hypertension and gestational diabetes. Yep. So that's our next area of research.
So you're not saying that women can eat what they want during pregnancy. There's still healthy guidelines
No,
really
I
around
think that's
that.
actually really important.
But there's not the guilt really around
Absolutely.
weight gain during pregnancy.
That's right. I think weight gain has been a very big focus in the past, and I think we need to change our focus to encouraging people to make healthy diet and lifestyle choices before pregnancy, but also during pregnancy.
Okay. And Alison, we might come on to another topic as well, connected with the pregnancy. It might be slightly delicate, but the age of women when they fall pregnant.
Yeah, so we know age is the most important factor affecting a woman's fertility, so essentially if you're 35 years or over, you're considered advanced maternal age, and what that means is that it might take a little bit longer to become pregnant, but it also increases your risk of having certain pregnancy complications. So that includes having an infant that's small for gestational age, or developing a pregnancy complication known as preeclampsia, which involves hypertension, other maternal end organ dysfunction, or fetal growth restriction.
Yes, and hypertension is high blood pressure.
High blood pressure, yes. Yeah, it is. And so I think it's important just for couples to understand, it's not always possible to have a child earlier in life, and so sometimes it's career, education getting in the way, financial constraints. Other times it's not having a partner, or the partner not being ready to have a child. But I think as long as couples are educated and know what the risks might be of delaying having a child, then they can make informed decisions. Yeah.
And you've been looking at some of these topics, not in humans, but in animal models,
yeah,
is that right?
Yeah, so I have a rat model of advanced maternal age, and so what we do is we take rats and we age them to approximately the equivalent of a 35-year-old woman. So that's about...
how old's that in rats?
It's about 9.5 to 10 months.
Okay, yeah.
And so...
how long do rats live?
Probably a couple of years, depending.
Okay.
At least they live longer when they're housed in our animal facilities than they would in the wild. So at this point we find they're still fertile, but they have reduced fertility. So around 50% of them will lose their pregnancies. We find that there is fetal growth restriction, and we see other things that are similar to what we see in women. So they end up having this larger placenta, which we think is trying to compensate and provide extra nutrients to improve fetal growth. And so what I'm quite interested in is, what is it about advanced maternal age that leads to these pregnancy complications? So some of the things I've investigated are the maternal vascular adaptations. So we know in pregnancy a mother's blood vessels adapt extensively, and these blood vessels aren't just in the uterus and the developing placenta, but they're systemically altered. And we wondered whether or not there might be some impairments in the ability of these blood vessels to adapt when you've got not just the challenge of pregnancy, but also ageing on top of that. And we have indeed found that there is some increased stiffness in the arteries of these older rats that may be leading to the pregnancy complications that we see. And we've also followed up with the offspring, because what we weren't sure is whether or not delaying, we know that certain insults in pregnancy can lead to complications for the fetus. So that might be, overnutrition, undernutrition, those sorts of things, but we didn't know whether maternal age might also be a factor. So what we did is we let these rats have their babies, and then we had a look at these offspring when they were adults, and had a look at how their blood vessels are working and how their hearts are working. And what we found is in young adult males from advanced maternal age mothers, they had impaired recovery from ischemia reperfusion, so essentially heart attack.
Heart attack.
Yeah. So if they had a heart attack, they didn't recover as well as male offspring from younger mums. And we also found that when we looked at their blood vessels, that their blood vessels couldn't relax to the same extent. So your blood vessels need to be able to relax, and I guess a way of measuring aging is to look at, or your cardiovascular disease risk is to look at your ability of your blood vessels to relax, and we found that that was impaired in these male offspring.
Yeah. So obviously that's an animal
it is,
model.
Yeah.
It's not been found in humans.
No,
yet,
it hasn't been investigated in women. So I guess that it's not to scare women that are having babies later in life. There's still a lot of research that needs to be done, and rats aren't women, but but it's still a good model for us to sort of find out what mechanisms. Like, the good thing about animal studies is you can look at what mechanisms are going wrong in those blood vessels, what pathways are changing, and so then we can take that information and then look at that in women to see if there's any clinical relevance.
Yeah.
So,
yeah. And potentially to manage that condition.
Exactly. And it also gives us the opportunity to look at potential treatments. So maybe the treatment is, losing a little bit of weight, so these older rats are a bit heavier than their younger counterparts, or maybe it's dietary interventions, and then can you improve not just the maternal outcomes but the offspring outcomes, and then that can inform clinical practice and that sort of thing. So, yeah.
And what about the age of men coming into kind of reproductive age?
Yeah, that's a good point. So it's not just the age of women, but the age of men is also really important. So we know that an older father, even if it is a younger mother, it will increase the time to conception, and it can also lead to pregnancy complications. So paternal age is really important, but also the health of the father as well. We know other factors like smoking and drinking and paternal obesity affect the quality of the sperm, which then can lead to increased time to becoming pregnant, but also impaired quality of the pregnancy and impaired fetal development.
Yeah. So it's a joint effort, isn't
it? Yes,
yeah.
exactly.
And so what might be some of the practical recommendations to break some of these cycles that we've seen? Jodie, what would be your recommendations, really?
I think from a clinical perspective, it's very important that people planning pregnancy give themselves the best chance. So I think preparing early, making sure that they have a healthy diet, that they're exercising and getting some physical activity regularly, and this applies equally to the women and to the men. Reducing alcohol consumption, all of those very modifiable changes that we can all make to our diet and to our lifestyle, I think are very, very important. I think education also needs to start very early on. So I think targeting women when they reach 35 and providing them with that level of information is important, but I think we actually need to take a big step back and start thinking about how we educate our younger children. So even starting in primary school, educating children around making healthy lifestyle choices so that those choices are very, very well embedded, and then when they become adults and become ready to be parents themselves, that their health is actually on track.
Yeah. Alison, any recommendations?
Yeah, I guess in terms of the age that we were talking about, it's not always in your control when you're going to be able to start a family, but like Jodie mentioned, if you can have a healthy lifestyle, make those healthy choices, when you are ready to have a family, you'll have the best possible chance that you could have. So, yeah.
So you mentioned that children born to overweight mothers have an increased risk of obesity themselves. Is that just due to pregnancy, or there are other issues that are at play here?
I think it's a really complex area. So our studies, our follow-up studies, have shown that around 40% of children at 3 to 5 years of age who were born to women who were overweight or obese and participated in our studies, that they themselves have a BMI above the 85th centile. So already at a very early age on the trajectory towards becoming overweight and obese children and subsequently adults. I think there's a lot of factors potentially that could be contributing in utero, so during pregnancy and during early development, but I think it's actually a very, very complex issue, and I think there are a lot of family factors, perhaps social factors that are contributing, and I think we actually need to be taking a very, very broad population-based approach to this. When we looked in detail at some of the dietary habits of the children and some of the physical activity that they were doing, most of the children weren't meeting current dietary recommendations for intake of vegetables. They were well over the recommendations with regards to discretionary foods. Most children weren't active to the degree that was recommended in guidelines, and also had vastly increased screen time. So this is being seen in children as young as 3 to 5 years of age. So we really do need to be thinking about ways and strategies to tackle diet and physical activity in children from a very, very early age.
So in terms of students that are potentially thinking of coming to university and are interested in these types of areas, these would be the types of questions and issues that they would actively be working on if they were to start. And so it's this integrated nature, I guess, of whole of life healthcare that's the next kind of frontier for work, isn't it?
It is, and I think it's taking that broad approach, looking at what we're doing with our research studies, but also looking, as Alison has said, looking at mechanistic studies. So we've collected a lot of biosamples for women and their children who've participated in our studies. So being able to look in a little bit more detail about how they relate to some of the clinical outcomes, I think will be important information to gain in the future that will allow us to perhaps target different pathways and different mechanisms.
So you've got some other large studies planned for the future around these issues?
We certainly have the ongoing...
Subject to funding, of course.
Subject to funding, of course.
Right, yeah.
We have our pre-pregnancy study, which is going to be a large study where we're aiming to recruit around 1,300 women who are planning pregnancy. We still have a lot of information available from 3 of our pregnancy-related studies where we have stored biosamples looking at cardiometabolic pathways, also looking at gene changes and epigenetic modifications. So a lot of information to sift through over the next little while.
Something to keep you busy.
It will keep me busy, yes.
And a whole team as well.
And the team,
yeah, that's
yes.
right. And Alison, I think we also touched on some of the issues around, older parents, but also the issues around the care aspects with those situations.
Yeah. So I guess one of the things to keep in mind if a woman or a couple do find themselves having a pregnancy later in life is that there is evidence to suggest that that woman or couple tend to have greater resources to invest in that child, and so
a bit more settled and
bought
the house maybe.
Maybe stable jobs, those sorts of
yeah.
things. They have access to tutors and those sort of additional things to help out their children with their education. And so what has been found so far is that the outcomes for children that are born to older mothers in terms of their development and their intellectual development and that sort of thing is that they're fine, like they do well. So.
Yeah, because of that support, that nurture.
Exactly.
Nature versus nurture issues.
Yeah.
And in your area, what are the horizons for future research and investigation?
Yeah, so...
More rat models, or are you moving...
So I will continue with my animal work to sort of look at mechanisms, but I'm also really interested in looking at clinical tissues from women during their pregnancies to then look at the particular mechanisms that I've identified in these animal models to see, whether or not they're relevant in, human blood vessels, for example, and I think that's really important as a way of identifying potential therapeutic targets that can then lead to the development of therapies to try and prevent and maybe ameliorate some of these pregnancy complications.
So with that ageing and the hardening of arteries then, that naturally happens, I guess, with age, but it's also diet related, isn't it?
Yes. Yeah.
So there's a lot we could probably do around diet as well to make our arteries in better health.
Yes.
And that ties into some of the health issues you've been investigating.
Exactly, and it ties in very much to Jodie's work that she's doing in the clinic. So
Yeah.
yeah,
So healthy diet, healthy lifestyle,
Yeah.
whole of life approach.
exactly.
Yeah.
Yeah.
Well, Jodie and Alison, thanks very much for joining us on the Discovery Pod.
Thank you.
Thank you. Thanks for listening to the Discovery Pod, brought to you by the University of Adelaide. Join us next time when we discuss renewable energies.